Hi, my name is Margie Dean. I'm a practical nursing instructor with MCC in the practical nursing program, and I actually am going to demonstrate and discuss how to take a blood pressure. First of all, as a student, we will give you your sheets that show you step by step how to organize your thoughts, how to organize your process. The first thing is assemble equipment. So what equipment do you need to take a blood pressure? Of course, you've got to have a blood pressure cuff. And there are many sizes of blood pressure cuffs. A normal, average adult cuff is going to be a normal size cuff, okay? Pediatric would be smaller. You may have adults that may have to have a pediatric cuff if they have a small arm. If the patient has a larger arm, you may actually have to have a large cuff or possibly what we call a thigh cuff. But we're going to assume everything is normal right now as far as size. So with a blood pressure cuff, let's talk a little bit about it. You're going to have the whole unit is called sphygmomanometer. This is called the manometer. It is a gauge that as you pump it up, you're going to pump up to 200 millimeters of mercury. And then as you let it out slowly, it will decrease in number. And then you will begin to hear a beat. This will be your actual systolic pressure. The systolic is the top number. It should be very strong. Then it will begin to fade. As it fades, you're going down, you're counting down, like counting backwards. Then you're going to hear a diastolic, which is the down number or the bottom number. The diastolic is going to be a little harder to hear, so you have to have a quiet area, and you have to have good stethoscope that you can hear and have it in your ears just right. So this is your manometer. You're going to have the bulb and a valve that you have to practice opening and closing. You can actually close it too tight and make it difficult to open one-handed. You have to learn how to pump it up to how you need it, 200 millimeters of mercury, and then release it slowly, and that does take practice. Okay. That is one piece of equipment. Then you have to have your stethoscope. Your stethoscope is going to have, of course, your earpieces, and if you've bought it, it probably has extra earpiece covers in case one were to break or come off. You're going to have an end that has two sides to it. This flat side that's larger is called the diaphragm. The smaller side, it's flat, but it's got a smaller diameter, is called the bell. Your stethoscope will rotate here to click so that you can change what side is more audible. Okay, I'll show you how to do that too. We have actually brought in some alcohol swabs because you don't know, if it's your stethoscope, that's fine. You clean the earpieces. But between patients, you're actually going to need to clean the part that's touching the patient. Some patients may have to have their own in their room, but for the most part, you have yours that you're carrying into the room. Now, blood pressure cuff might actually be one that's left in the room as well. Okay, so we'll clean our earpieces, clean our diaphragm. So we've talked about the equipment, we have it together, and we would go in and discuss with the patient that we're going to check their blood pressure, and you identify them, you introduce yourself, you identify them ×2 by asking them to state their name and then their date of birth. And a lot of patients know what taking a blood pressure is about because they look forward to it actually. So you want to wash your hands or hand sanitize. Now we're going to position the patient's arm so that we can use it and they're at rest. But let's talk about which arm we can use, because there will be circumstances that you cannot use a certain arm. If the patient were to have had a mastectomy, which is a breast removal for cancer, then you're not to use that arm because of the lymph glands and lymph nodes that you could actually cause more edema or swelling. If it is an arm that has an IV, we don't choose that arm because you don't want to constrict the arm, and then you're going to actually, you could damage the vessel that the IV's in. You do not want to use an arm that has what we call a shunt, an AV, which stands for arteriovenous graft, which is usually for your hemodialysis patients because you could occlude that or damage the actual catheter there. So if you ask the patient, if you don't already know, is there a particular arm that you prefer I take your blood pressure in? Patients know what arms they should not have blood pressure taken on. So we're going to actually use this right arm. When we put the blood pressure on, you need to find your brachial artery. And your brachial artery is this is called an antecubital space. Your brachial artery is going to be on the inside, okay? If you cannot feel the brachial artery, because there might be extra tissue there, put your hand on their elbow, and sometimes just holding that and then pushing down, you can sort of feel it better. If you cannot still feel it, do not worry about it, because this is where the diaphragm of your stethoscope should go, and then you should be able to hear the blood pressure. So when you put the blood pressure cuff on, it's going to have an arrow. It may say left arm or right arm, but this one has an arrow that says artery. That is what goes over the brachial artery. You want to come up about 2 finger breadths, 2 inches above that. Then you wrap the blood pressure cuff. Here's the brachial artery, and you can see them about 2 fingers above the brachial antecubital space and the brachial artery here, okay? If you have trouble seeing your manometer, you can remove it and kind of sit it closer, but I'm comfortable with how this one is right here. When you put your earpiece in for your stethoscope, you want to make sure that it is slanted up slightly. If it is down, you're not going to be able to hear because it's not going to go into your ear canal like it should. So you want to have it slightly bent up. Then you want to place it in your ears. Now you want to make sure, I always just feel it in. Okay. Do not, and you can tap this by seeing if you can hear it good. Okay? Remember we said we could turn it. If you can't hear here, you're not going to be able to hear the blood pressure. Do not hold it with your thumb. Because of the pulse in your thumb, you might actually mistakenly hear yours and theirs together and then mix it up. Don't put it underneath the blood pressure cuff to let it hold it for you. You want to hold it with your fingers. And you always tell the patient, this is going to be a little bit tight, but I'll let it out just as fast as I can, okay? I'm sorry, and it might tingle a little. So you pump it up to 200. I'm sorry, I know it's tight. Then you begin to slowly release it. And as you slowly release it, you're going to listen for the systolic or the first beat. Oh, there it is. Continue to listen. There's the last one. So what I heard was 130/80. So you continue to let it completely out. Now, if you are not sure and you need to listen one more time, that's fine. You just make sure that you leave the cuff deflated for just a little bit before you go back and do it again, okay? So one more time. We've made sure we have the diaphragm where you can hear it. this over the brachial artery. This is going to be a little bit tight and it might tingle. Pump it up to 200. Slowly release. So I heard the first beat at 128. And the second one at 80. So I continue to let it completely out. So then you would want to document what you heard. Even, if it takes you 2 times to get it, then that's just making sure that you heard it the right way. So let's look here and see what other items we needed to talk about. We talked about observing the manometer gauge. We're recording the systolic, decreasing pressure slowly. The last sign we record is the diastolic, repeat if needed. Then we're going to write the results down. You want to make sure you take the equipment off, and you're going to clean your stethoscope, and you just unwrap this. And make sure you leave them comfortable. I always look at the arm to make sure I didn't pinch it in any way. Then you're going to wash your hands and you're going to document, okay? So what you'll do is, if you're going to document, I'm going to say that the blood pressure was 128 over 80, okay? Now to go to the actual graphic sheet, we would have the patient's name and the date. Today is 08/26/2020. The time now is, it's 3:30, so we're going to put this at the 4 p.m. slot, which is going to be 1600. We come down here to the blood pressure, and if you'll document what you got right here, 128 over 80. And you want to make sure it's legible, okay? And then you've left them comfortable, side rails up, collar belly reach, bed down as low as it will go. If you have complications with the blood pressure, whether it's too low you cannot hear it, or whether it's too high and you need somebody to verify it with you, then that's what you need to do. Thank you very much.